there is a new term in our menopause lexicon, the musculoskeletal syndrome of menopause. I used to make a joke back when I was a baby physio, and I think lots of physiotherapists notice this, but when I was working with orthopedic patients, that when a woman went into menopause, we would see things like frozen shoulder or lateral hip pain, plantar fasciitis, these inflammatory joint and musculotendon issues. It was a paper that was recently published by Vonda Wright in this past summer, 2024. And they base these mechanisms, these like joint and muscle and tendon issues that happen, that tend to be more present during menopause, on 5 things: inflammation, swelling, irritation, pain, that type of thing; sarcopenia, which is age-related muscle loss, and that can lead to things like poor balance, obviously losing muscle, stamina, strength, that sort of thing; decreased satellite cell proliferation. So satellite cells are like stem cells located on muscle fibers, and they help to promote muscle growth and regeneration and muscular plasticity. And so again, we'll see this loss of muscle mass that's associated with this factor. Osteoporosis, so our bone health. So osteoporosis would be like a loss of bone density, height loss, low impact fractures that would happen. And number 5, arthritis. So joint pain, joint stiffness, loss of flexibility in the joints. So what does this mean? Now that we have a term for this phenomenon that we've been witnessing, we will see more research being done. We will start to see family physicians, orthopedic surgeons, allied health professionals like physios, massage therapists, chiropractors, watching for these changes, hopefully encouraging healthy behaviors like exercise, strengthening, stretches in early 40s, so as maybe we will see some prevention for the onset of this problem as women go through menopause. We will also see, hopefully, whether things like hormone replacement therapy will be a benefit, because right now we have no real research to say if hormones can help with this joint and muscle, musculoskeletal syndrome of menopause. And so whenever we have new terms like that, we will see more discussion around it, similar to what we saw when the term genitourinary syndrome of menopause became a thing, and we saw a lot more research being done on vulvar, vaginal, bladder health. So I'm very hopeful that we will start to see some movement forward in the ways of joint and muscle pain as women go through menopause, and we'll see some really good evidence-based solutions presented to them.